You hear me talk about all the time how important a great smile is for health and happiness. You know, spending all your time trying not to smile, have you ever known people like that? You know, or they go. In most cases, your smile can be straightened out. You know, there are so many great things with new technology. One of them is Invisalign. Here to tell us more, Mike O'Neill. He's from Twin Aspen Dental. Mike O'Neill, and your father is the dentist in charge, right, Mike?
Correct.
Mike, let's talk about Invisalign. We always mention Invisalign, or people say Invisalign, but I don't think we've ever on the show actually showed it. And it works faster, right? Than
in some
normal
cases,
braces?
yes.
And how invisible are they?
I'm actually wearing them right now,
Okay.
Tom.
Now, I just want you to smile for the camera here. Just smile. Let's see. Okay. Bonnie, can you show a smile? You don't take them out yet. You have them on. I just want to show the smile here, because I could never tell unless you told me that. And how long do people wear them, and are they graduated? Do you start with one and then move to another?
Yeah.
Show Bonnie over here. She's right there. Okay, Bonnie, can you just show that real quick? And he's okay. So you put that up on your, and that's it.
Yeah,
that's it. No rubber bands, no bands,
No
nothing.
brackets or wires. It's
Okay, now tell me, how long do people usually wear them, the whole series?
Well, most of our patients finish their treatment in about 6 to 8 months.
Really?
There are shorter cases and there are longer cases. It depends on how complex your case is.
That's pretty cool. Now, as I said, do they start out with a thicker one and go to a thinner one, or do they all?
Well, they're all the same thickness.
They're all the same, and so they're all the same invisibility, so to speak.
Right, and they all mold to your teeth while they're moving. So you're going to have a series of these aligners here that fit onto your teeth.
Now, are those aligners in the correct alignment, and they're gradually moving your teeth? Is that what happens?
Correct.
So when you put them on, do you feel a little pressure?
You do feel pressure.
Okay.
A little
that
bit.
means that they're working.
Yeah, and actually, I was surprised. I thought that you might have that kind of constant pressure.
Now show when they're on here, and point to the camera over here. Bonnie and Clyde. Her camera's name is Clyde. Okay.
So basically, they just fit on.
Cool.
They snap onto your teeth.
Now
like
here's
that.
what I want to know. Do you take them off at night, or do you sleep with them? And do you take them off obviously to clean your teeth, right?
You're supposed to wear them about 22 hours a day.
But what's really cool about it is you can brush your teeth, you can mouthwash. You don't have to. They don't get yucky. You can even clean them out, right?
Yeah. I actually just brush mine.
As opposed to braces.
Yeah, I just actually brush mine. You can eat what you want, you can drink what you want, and you just brush your teeth after, and you floss normally.
So what are the benefits? It's quicker. They're removable. Mm-hmm. You don't have that. You don't have the uncomfortable twisting of the wires. Are there cases that are too severe for Invisalign? I'm sure people are listening, saying, "Wait a minute, can I get them?"
Very few cases.
Very few are.
Yeah.
Do they hurt? Do they feel? Do they sting or anything? What is the feeling on those?
Personally, I had braces twice when I was a kid. And,
oh, wow, look at this. This is a severe case. Now, this is not yours, but I'm sorry to interrupt you, but we saw this picture. I want to see what you were able to do with Invisalign here. See, that's almost hard to believe.
That's actually a patient of ours that's a 43-year-old real estate agent,
wow.
And she was always concerned with her smile.
How long did that take?
Her case was only about 8 months.
See, that is incredible. Wow. So, you know, a lot of times people opt for cosmetic dentistry. And with this, you may not need it, or you may need a lot less.
I think that this could possibly be some of the best bang for your cosmetic buck. Yeah.
And if you still do need maybe to change the shape of a tooth or a veneer afterwards, you can always do that.
Absolutely.
Now, do you guys, what do you do at your office? You do a lot at Twin Aspen Dental. What do? You do Invisalign.
We are a family dental practice, and our doctor, Dr. O'Neill, he is specially trained in almost every dental procedure that you can think of.
So he does cosmetic dentistry, he does Invisalign.
Absolutely.
And you have insurance, financing. And what about for teenagers? There's, by the way, your father, Dr. Larry O'Neill. And he's been around a long time, a lot of experience, 26 years, a military dentist. He's seen it all, hasn't he?
Yeah.
Now, he never has to refer to another dentist. He can if he wants, but I mean, he's been in practice for long enough that he's pretty much does it all.
Yeah, we very rarely refer out. There are some very complex cases, surgical cases sometimes that we'll refer out, but we do all of it in-house.
Okay, so let's talk about teenagers and Invisalign. Again, we have young people probably saying, well, will it work for me? And what are we seeing?
This is one of the most exciting things, I think, is the new Invisalign Teen product. I had braces twice when I was a kid in high school. I had to have them when I was a junior in high school. And, you know, I took a lot of pictures, prom pictures, senior pictures, with braces on.
And what is this? What are we seeing here, the Teen product? How does the Teen product differ?
This is the Invisalign animation. It basically shows how your treatment progresses over the series of aligners that you get from Invisalign. And we show this to every patient before we actually put them into the aligners, and it's a really good, I mean, it shows before and after before we even put them in treatment.
Are the Teen Invisaligns different, or are they the same, basically?
They're a little bit different. Invisalign did not want to do a teen product at first because of the complexities of a teen's growing teeth. You know, basically they haven't erupted fully.
In fact, there's a lot of controversy and there's a lot of discussion as to whether you should wait and not have childhood braces anymore. Some people say get them at 5 and 6 or 8 or 9, and others say no, wait till they're teens or older. And Invisalign, you can wait older.
Right. Well, and now with the teen product, they've made some changes that allow us to do the ages about 13 and up. So kids don't have to really go through the brace face years, you know, in terms of, you know, going through high school, taking pictures, you know, having to mold a sports guard over their braces if they're into sports.
When did you notice a difference? You put them in and you say, that one dramatic before and after, and I don't know if we have any more before and afters, but that one dramatic one.
I just brought one.
Well, that's good. That's a dramatic one, 8 months. When do you start noticing a difference? Let's say you get it done. Let's say you have a case like that. Do you notice anything, or is it so gradual you hardly notice?
For me, it was right away. I know I grind at night.
Yes.
And I noticed that just with the thickness of the aligners and also the fact that they were starting to move my teeth into position.
So, would you say in a month or so you can actually see some slight changes?
Yeah, absolutely.
This woman has to be thrilled. Now, we're going to do something here. This is cool. We're going to combine a screaming deal here with your appearance, okay? So Twin Aspen agreed to do this. They're going to do a mini smile makeover. So if you sign up for an Invisalign treatment and consultation, you know, and of course go through with it, they're going to do their teeth whitening free at the end. They're going to do it for you, and you'll have your own trays, and we'll tell you why. A $500 value. And of course, while you're there, because our doctor here has been around for so long, he actually, 30 years, what can happen is Dr. Larry O'Neill can analyze all of your other dental needs. But you can go in, and this consultation for Invisalign is free? Complimentary?
Yes, okay. Our consultation is free, although one of my assistants said that she would like you to bring a panographic x-ray. That's the x-ray that goes all the way around your head.
That would be good. Now, if you can't, do you guys do those there?
Yeah, we'll do them.
All right. So 303-841-7466. So if you don't have an x-ray, there might be a charge for x-rays if you want this done right. But certainly they'll answer all of your questions first. 303-841-7466. Now, 841, that's Parker?
Yes, it is.
And where are you located?
We are located just off of Parker and Main Street on Pikes Peak Drive.
Twin Aspen Dental .center. Is it dot? No, it's
Twin
center.
Aspen
I'm sorry.
Dental Center.com.
Move that monitor up. I'm sorry. Okay, Twin Aspen dentalcenter.com. You'll see it. People reading it now. Okay, Dr. Larry O'Neill. That's 303-841-7466. And what I wanted to mention is that you're going to do that teeth whitening free as part of it. Now, I said you will have trays already. Why is that? This is a cool thing you told me at the end.
Well, here your final set of aligners, where your teeth are all straightened out and everything. This makes a wonderful little whitening tray. So if you guys don't want to do the in-office treatment, we'll set you up with some
solution.
take-home gel.
That's pretty cool.